Good afternoon. My name is Perlita Espinoza. I'm here to talk about the asthma prevention. But before we begin for the prevention, we have to know what is asthma first. Does anyone here in the group who has experience or who has asthma? Nobody?
Ah,
Okay. Oh, you have?
yes.
Okay. So usually, when does it start? What age usually
I
you
think
have?
when I was younger, I had experienced asthma. So times when I was too tired at school, perhaps, and I couldn't sleep well at night. I'm not sure if the right term for that was nocturnal asthma.
Okay. So that's true because asthma can be experienced by any age. You can start at 7, younger than 7, or even if you're in your age of 60s or 80s, you can have asthma. So what is asthma? Asthma is a chronic lung disease that usually inflame the inflame and narrow the airways. What does the patient with asthma usually experience? When you had asthma, can you recall what you had experienced?
Um, I had difficulty breathing, and I couldn't sleep. So and there was also wheezing. Those
Okay, so you can see on my slide is the different signs and symptoms that a person with asthma can experience. You have tightening of air passage. So that's why they experience the shortness of breath or the difficulty of breathing. So some of them, they experience respiratory distress because the passage airway is inflamed and it is narrowed, so there is not enough air that coming in and out on the passage airway. So they experience wheezing, or what we call the whistling sound, with the use of through auscultation, then coughing, a tightness of chest, a difficulty of breathing, and some of them they have thick mucus or lung mucus. So this shows what happens to the passage airway for a client with asthma. So you can see it becomes inflamed and narrow. This is the normal airway, and this is the one with the client with asthma. So how can we prevent asthma? Okay, the first intervention or the first prevention for asthma is to make an asthma action plan. So what this action plan usually do? If you're a person who frequently who usually had asthma, you need to know what usually the cause or what triggers your asthma. So you have to prevent it. And then what are you going to do? Are you going to take a medication, or it is the right time to go to the doctor? So that's part of your action plan. Another one is have influenza and pneumonia vaccine. Here in our country, they usually start by month of September in preparation for the December, the winter time, wherein it's usually cold, and there's a high incidence of influenza and pneumonia. So identify and avoid asthma trigger. So what usually trigger asthma? We have exercise. If you exercise a lot, or I mean it's a heavy exercise, so there's a tendency that you can experience asthma. Pollen, usually it happens during fall, and then um, bugs or insects, chemicals or fumes. That's why in most institution or establishment, like a school or hospital, perfumes are not allowed because some usually trigger the asthma because of perfumes. Okay, cold air, fungus or spore, the dust, smoking, pollution, anger, and even stress or pets. Me myself, I have asthma since I was 7 years old. The one that usually trigger me is the weather and also the pets. That's why we don't have animals at home. So we have to monitor the breathing pattern. Why? Because remember, one of the signs and symptoms of a person with asthma is shortness of breath. So if that shortness of breath cannot relieve by your nebulization or by your popper, so it is the right time you have to consult the physician. So we have to determine and treat the attacks early. So how can we treat the attacks early? By identifying the one that cause or trigger your asthma attack. And if you're usually frequently has asthma, you must have a popper on your pocket. You always have to bring it with you. I have a clip here. This is one of my favorite TV series, Doctor House.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, so what does the video show? So as a healthcare provider, as part of the team, we have to instruct the patient well on how to use the medication that was prescribed by the physician. So how do they use the popper, the nebulization, how are you going to perform it do it at home. So what are the medication that usually prescribed by the doctor? We have the anti-asthma like the Ventolin. We have antihistamine like your Claritin or Reactin, and a corticosteroid like the Buticort or Pulmicort. So to sum it up, so my topic is about asthma. This is a chronic lung disease that narrowed and inflamed the airways. So, do you have any question?
Yes, I have a question. Is asthma congenital also? Like, I mean, hereditary? Can we get that one from our parents or relatives?
Yeah, based on what I have read, they said that asthma has, it can be familial. So it means you can inherit it if one of the member of your family, your grandmother or grandfather has an asthma.
Okay. Thank you.
Okay, that's all. Thank you.